Okay, Sani, it started from my end. I'm ending it. You can start from your end.
I told you.
Oh no, I'm just ending this meeting. You can start again.
I had already started the meeting and it didn't get. Hi everyone. A very good evening to all of you. I'm sorry for the delay, but I hope all of you can hear me now. That's right. Okay, everyone, please tell me your names and where you're from. I would like to know all of you. And also which profession you're in. So are you a pharmacist, a nurse, a doctor, a dentist? So please do tell. I would like to know from all of you. We are going to start shortly. So my name is Sanya, and I'm one of the senior trainers at Khaira Education. And Khaira Education is a premium provider of OET. And we have 3 branches in Mohali, Delhi, and Amritsar in India. But we have many online courses as well. So students can join from any corner of the world. And we offer very intensive courses as well as the courses that are quite flexible according to your time schedule. So you have the information given right here on the screen, and you can reach out to us anytime. Okay, I can see some of your responses coming in. So Rebecca from Zambia. Hi, nice to meet you, Rebecca. And Dr. Neredu, yes, I do know you. From Botswana, yes, many students are there from Botswana as well. Great. David, hi. Hi, Nazia. Hi, Shivani. Hi, Rupinder. Hi, Janadri. Please do tell me your professions as well. That would help me understand who my students are. So that's great. Okay, wonderful. Hi, Tina. Okay, so one of you said, Rico, that you're writing your OET test tomorrow. All the very, very best for you. I hope these last minute tips that I'm going to discuss would help you in the exam tomorrow, because I'm going to discuss some things which can be immediately applicable when you do your next role play with a friend or with a trainer. Okay, so I think we can perhaps start. So just to give you a quick overview of the format of the speaking test, some of you might be joining for the first time, so it would be great if you could get to know the format of the speaking test. So the total time of the speaking test is around 20 minutes, and there is a warm-up section in the beginning for 2 to 3 minutes, in which the interlocutor, whom you will be having the role plays with, is going to ask you a couple of questions about your job, about your day at work, so that your nervousness can come down. So this section is not assessed. It's a common misconception, but that doesn't happen. After the warm-up section, there are 2 role plays that are going to happen. And for each of the role play, you will have 3 minutes of preparation time. And for 5 minutes, the role play will take place. So in your preparation time, so just before that, you get a cue card. So that taking help from that cue card, you have to prepare for 3 minutes, and then the role play takes place. And I will just show you what the role play card looks like. So something like this. So it will have 3 things. There would be a setting, like here it's secondary school. Sometimes it could be clinic or a hospital ward, or it could even be a home visit. So depending on that, our approach to the task always changes. So there is no template that we can learn. And then you can see where nurse is written. So depending on your profession, here it could say doctor or pharmacist or dentist, physiotherapist. And then there would be some background information written about the student. And then you can see that there are a couple of tasks that you have to fulfill. Now, please remember that here there are like 5 tasks. In the exam, you could have less than that, you could have more than that. There is no fixed number. But please don't rush and finish all the tasks. I mean, you have to try your best to do as many as you can, because that gives you a chance to showcase your communicative skills. But completing all the tasks or not is not going to have that much of an impact on your marks. So in none of the assessment criteria, it is written that task completion has marks. So no, if suppose you have 7 tasks, you're able to do just 6. If you're able to do them well, you can very well clear your exam. If you're left with 1 or 2 tasks, that's not going to impact your score in any way. The only thing that will impact your marks is like the assessment criteria, the linguistic criteria, and the clinical communicative criteria. So just to give you a little bit brief about that. So this is how basically you are assessed. So there is the linguistic criteria where 4 things are there: intelligibility, fluency, appropriateness of language, resources of grammar and expression, and all of them carry 6 marks each. So your linguistic criteria is of 24 marks. The clinical communicative criteria in totality is of 15 marks, and there are 5 things there. So one is relationship building, the second is understanding and incorporating the patient's perspective, then providing structure, information gathering, information giving. So there are a lot of things included. And if you succeed in all of these, that is when you will get a good score and pass your OET. So today I'm going to tackle one of the topics here, which is information giving. So let's dive into it. So today we are going to discuss how we can give information clearly and accurately, and there are many things to be included in this topic. So I'll try to cover them one by one. So the first one is called establishing what the patient knows already. So just want to take your input. So just from reading this, establishing what the patient knows already, can you tell me what do you think it includes? So you can type it in the chat. Okay, Sakshi says checking patient's prior knowledge. Yes. Explaining. Okay, you'll have to be more particular than that, Raya. Previous knowledge. Yes. Knowledge about what? Prior knowledge of patient. But you're missing something. Knowledge about what should we test? Prior information, Kupiwa says. Okay. Condition. Amir, good. Namita says about the condition or situation. Prior knowledge about his or her condition. Yes. Tumi says it includes existing knowledge of the patient, something he already knows about health or well-being. Okay. Knowledge and past medical history. Janadari says, all right. Okay, so yes, most of your guesses are accurate. So let's have a look what it actually includes. Yeah. So establishing what the patient knows already, this refers to the process of assessing the patient's existing knowledge, as all of you said, and understanding. So not just knowledge, their understanding of medical condition, symptoms, or treatment options. So it could be either of these. And it involves gathering information about patients' previous existences, beliefs, and any relevant information they may have acquired. So many times patients they have heard of some conditions, like people might know about hypertension, diabetes, but they might have a wrong understanding of it. So that's why it's very important for us to understand their beliefs about the conditions or the treatment options, so that at any point of time, you might even correct it if they have a misconception. So why is this step important? It's important because it helps healthcare providers understand patients' baseline knowledge, correct any misconception, and tailor their explanations or educational materials accordingly. Secondly, by understanding what the patient knows, healthcare professionals can effectively communicate with them, provide appropriate information, and ensure a shared understanding of the medical situation. Coming back to the first point, that's very, very important. Now, if the patient has only given you half of the information of what they already know, so tailoring your explanation would mean that you will only give them the information that they require. So maybe they know half of it already. So that is why it is so, so important. There are 2 things we have to absolutely avoid. So we should never assume that the patient doesn't know anything. That's a very bad assumption. Secondly, we also shouldn't assume that the patient knows everything. So we don't need to explain. So what is the right thing to do? The right thing to do is to ask them, so how much do you know about this? or what is your prior knowledge about this condition. Only then you can understand how much they know and how many gaps you have to fill in their knowledge. So for example, as a healthcare professional, you could say that we suspect that your mother has Alzheimer's disease. Have you heard about it before? So immediately you would get some input from the patient, whatever they've heard of it, be it wrong beliefs or right beliefs. Of course, we should never be judgmental about that, but that will help you later on correct any misconceptions that they have. Another example would be, so suppose if the patient might have heard of diabetes, but maybe they don't understand it. So this is something the patient can say. I've been told that I have diabetes, but I don't completely understand what it is. So as a healthcare professional, this is something you can say, that it would be helpful for me to understand a little of what you already know, so that I can try to fill in any gaps for you. Now, this will also help the patient feel more comfortable that, okay, here is a person who's interested in, and they're understanding that I don't have complete knowledge, and they're actively trying to help me understand it properly. And secondly, as healthcare professionals, again, it helps you understand what gaps you need to fill. So these statements you could definitely use. Let's look at one more example. In the same situation, you could also say that I would like to check what you already know about this condition. Are you familiar with the different types, treatment options, or lifestyle changes that may be necessary? So here, because we are trying to understand what they already know, so we could give them some prompts that perhaps they might have heard of this or that. So this is also an appropriate statement to say. Now, another example. So suppose if the patient is taking some medications for hypertension, but they might come to you unsure of whether to continue the medications, or they might have a doubt about it. So if the patient says something like this, I've been taking these medications for my hypertension. So just for your clarity, because the patient could be presenting to you for the first time. So you also want to check like whatever prior knowledge they have is correct or not. So you could say, that's great. Can you tell me more about what you know about hypertension and the importance of taking medications? It will help me understand your perspective better. Now, this last line is also quite good because, we are also satisfying the patient that we're not questioning you. It's just so that we could help you better by understanding your perspective. That's why we are asking you this question. So, yeah, you could use either of these statements. So in this case that we have just seen, so the healthcare provider encourages the patient to share their knowledge about hypertension, its causes, and the rationale behind medication usage, allowing them to identify any knowledge gaps or misconceptions that they might have. And secondly, by initiating the conversation in this particular way, you can build upon the patient's existing knowledge, fill in the gaps, any information gaps that are there, and establish a foundation for effective communication throughout the healthcare journey. So immediately the patient would feel more comfortable. You will have a clearer picture. It works in both these cases. Okay, so now that we have discussed the first aspect of giving information accurately and clearly, so now it's time for you to tell me. Suppose this is the scenario. So your patient is a 45-year-old male who presents with chest pain. So how will you check patient's prior understanding of the symptom if this is what the patient says? So the patient here says, I'm having this pain in my chest. I'm worried it might be a heart attack. So over to all of you, tell me in the chat, how can you assess the knowledge of this particular patient? So you could frame the questions, you could take hint from the sample statements that we have discussed. Okay, Haya says, have you ever had heart attack before? Okay, but this is more about checking their understanding of the condition. So Haya, maybe you could change it a little bit depending on that. Shamal, you say, have you experienced these symptoms before? That was more into history taking. Think about checking their understanding. Okay, so Kinza is first of all empathizing. I'm sorry to hear that. But could you tell me more? Yeah, Sidhu, I want you to complete that sentence. Tell me more about what? Gagandeep, you say, could you tell me more about your symptoms? But you are basically asking open question to gather information. Here we are checking what they already know about something. Yes, so Gulade, I think you've got it right. So you've said, I'm sorry about the chest pain. Can you tell me what you know about heart attack? Yes. So we are trying to assess their prior knowledge about heart attack. Yeah, so if you ask questions like what kind of pain is that? How long have you had these symptoms? You're gathering information so that you could probably diagnose better. This is not what it's about. It's about checking their understandings that what they're saying, uh, how much do they know about that? Yes, so Annalyn, I think you also said it correctly. Could you please tell me what you know about heart attack? Yes. Angelique, what information do you know about heart attack? Yes, exactly. Um, yes, Dr. Purva, your question is also good. Isabel, may I know what you already know about heart attack? Yes. Can you tell me more about heart attack? Now all of you are getting it. Perfect. Yes, so that is what it's about. So this is a sample statement that you can now see on screen. So you can say that I understand your concern. See, I mean, all of you were also empathizing first, so that's always important. Can you tell me what you already know about chest pain and heart attacks? Or you could say, can you tell me what your current understanding is related to chest pains and heart attack? So not just heart attack, you could ask about chest pain in general. Sometimes people might have some misconception about it. So that gives you, an opportunity to clarify that as well. Now, another thing I noticed, one of the students said, I'm so sorry to hear that. I would advise you not to use that term because it's very general. So whenever we are empathizing with the patient, so we should always be particular and personalize it. So you could probably say that, I'm so sorry to hear that you've had this chest pain. It must be difficult for you. But could you tell me more about what you know about heart attacks? So that sounds much better and more genuine as empathy. So avoid saying just the phrase, I'm so sorry to hear that. Okay, so that was a little tip. Right, so this was the first thing that we discussed, establishing what the patient knows already. Now, to go to the second thing we must keep in mind while giving information. For that, I'm going to give you an example. So you're going to listen to how I am giving information, and you're going to tell me whether it is a good way to give information or not. So this is a scenario. So I'm giving all of you some time to read it. So this is something you have to explain to the patient. All right, I hope all of you have read it. So now I'm going to give you an example of how I'm giving information, and you have to tell me whether I give it in a good way or not. Okay, so as a healthcare professional, I'm saying, so now I want to tell you about the importance of cautionary measures related to warfarin. You need to minimize vitamin K in your diet. You have to avoid OTC medicines due to their interaction with warfarin, and please take a dose at the same time each day. Is it clear? So I have just given information about this. So now over to all of you. Do you think that was a good way of giving information? All right, some of you are saying no. Okay. A lot of you are saying no. We have a lot of critics today, but that's good if you know why. So yes, now you can tell me, why do you think? What were the points that made you feel that it's not a good example? Very good to me. So you said for a healthcare professional, it's clear, but for a patient, it won't be clear at all. Yeah, right. I'm using medical terminology. Very good. Ramandeep, explaining the medical terms. It's not polite, Lakshmi says. I agree. And Mary says that provider should explain it in details. Yes. Signposting is not there. Very good that you noticed that, Amir. Okay, so Sharda says chunking and checking. Okay. Right. So yes, picking it up from there. So that brings us to the next point. Whenever there are some lengthy bullet points, especially you can see there is some bracketed information over there. So this is something we must ensure, pausing periodically when giving information. And this is also very important, using the response of the patient to guide the next steps. So what does it include? So we have to avoid giving a large amount of information all at once, like I did. So please don't make that mistake. So a long monologue, again, like I did, it will produce a strong primacy effect that the patient is still thinking about the first point as the next three are being presented and is distracted from listening to the later pieces of information. So that is the meaning of primacy effect. Primacy effect means that if I'm giving you too much information, you will only remember the first one and you will not even, focus on what I said later. So based on how I gave information, patient would just remember one thing that, okay, this nurse just told me some cautionary measures, but they might not remember anything after that. So we should avoid that. So yes, one of you said chunking and checking. So yeah, that is precisely what we have to do. Now, what does this mean? Chunking means breaking down longer explanation into smaller pieces or chunks. This can aid the patient's understanding because smaller chunks of information are easy to process and retain for the patient. As they assimilate each section of information, they will become ready for the next one. That is why pauses are important. Give them time to process information. What is the rush? I already told you, it's not absolutely compulsory to, do all the tasks. So you have to try your best to give information in the best possible way. This technique is also a vital component of assessment of the patient's overall information needs. And if the information is given in small chunks, and if the patient is given enough opportunity to contribute, the healthcare professional will receive clear signals about the amount and type of information that is still required by the patient. So it's very important that we keep their responses also in mind. So unless we give just one chunk of information and check whether they're understanding or not, how will we know whether they are with us or not? Otherwise, the whole conversation is going to be a waste. So we have to avoid that. So how can I do chunking and checking? So after each piece of information, the patient's understanding must be checked with a follow-up question like, are you able to follow me? Do you have any questions about what I just explained? Is it clear so far? So after asking one of them, of course, don't ask all of them because that would mean that you're asking a compound question. So just one of these you can use, and then you give the next chunk of information only when you as healthcare professionals are confident that the patient has introduced the previous one. Right. So now based on what I just explained, now I will again try to give information. Now you can again tell me whether I did it in a good way or not. Okay, all my critics, I hope you're ready. All right. So as a healthcare professional, I can say, now I would like to tell you about the importance of some cautionary measures that you need to take regarding the use of warfarin. May I proceed with that? The patient will say yes. So you can say, firstly, it would be important that you minimize vitamin K in your diet. Do you think you will be able to do that? Patient might say yes. And then secondly, I advise you to avoid over-the-counter medications. So if doctor has not prescribed you any medications, you could avoid taking them because they might not interact with warfarin properly, and it might lead to a negative effect, which we are trying to avoid. Are you able to follow me? And then I can ask the next one after the patient's response. Lastly, I would recommend you to take a dose at the same time each day. So for example, if today you're taking a dose at 1 p.m., I would advise you that on the following day and subsequently every day afterwards, you take it at 1 p.m. Do you think you can do that? Hopefully they'll say yes. So yes. What do you think now? Was it a good example of giving information? Okay, all of you are approving. Okay, great. So my students have approved. All right. So yes, I think you said I could give examples of vitamin K. So that's a good point. So please remember that we should try to stick to the task as much as possible. So the OET criteria is such that we don't have to add anything on your own. That is why I didn't really spend too much time in explaining vitamin K. Also, if the patient would ask me, because right after saying vitamin K, if the patient asks me, that, can you tell me a little bit more? Then I would definitely do that. Mostly, if we need to explain something to the patients, it would always be written in your cue card. So that's why, yeah. Okay, so now it's time for all of you to do a task. Now, this whole kind of a paragraph that you can see here. So this is a sample response of how one of the students had given me some information. I would like to ask you to break it down in chunks. So where exactly would you have that break? So maybe you can write C1, that chunk 1 would be just from here to here. And the next piece of information you would give is this one. And the third piece of information would be this one. So at what point would you be checking the patient's understanding? So yes, over to all of you. So perhaps we could start with the first one. So after what line perhaps, or after what information would you give the first chunk? Or when would you check? Okay, Namita says increasing the level of iron and till cereals. So you're saying that you would probably give the examples and then probably you will ask a checking question. Okay. After etc. Yes, Amir. I think all of you want to give chunk of information till there. After etc. Kopiwe says the same. Rich food about diet, Kinza. Yes. Okay, yeah, we can go to the second chunk. So after etc. So then the next one should be absorption of iron in the blood. Okay. All right. Yeah, I think all of you are agreeing that the first chunk of information should be increasing levels and then giving some examples. And the second chunk should be, I would also like to discuss some things and then talking about like some things you can do to enhance the absorption. And then you can quickly have a question. Are you able to follow me? And then, yes, the last one could be combine iron-rich foods with vitamin C-rich foods to promote so and so forth. Okay, that's great. Yes, so these could be the three chunks that are there. Yes, I think to me you are also saying that until the blood. So till then we could break down the chunk. Absolutely correct. So this is how, please make sure. Sometimes students have a habit that if there's a very lengthy bullet point, it contains a lot of things in the bracket. So it's not that you should say all of it together and only then you can ask, is it clear? No, if you keep asking the patient in between after breaking it down, that is what will really help with effective communication. Yeah. Okay, so let's go to the third thing, which is kind of related to chunking and checking, which is encouraging the patient to contribute their reactions and feelings. Now, if you remember the example that I had just given you while I was doing chunking and checking, after telling them about the dosage, I asked a question, do you think you will be able to do that? So I didn't ask, is it clear? It could be clear to them, but we still need to ask that, will you be able to carry out what we are asking you to do? So we have to encourage the patient to contribute their reactions and feelings. So as healthcare professional, you can actively encourage the patient to contribute their ideas and suggestions too. So you could, even ask them that, what do you think about these suggestions? Or what would you suggest? So it's perfectly okay to say that. The more you, elicit from the patient, the more they're able to comfortably have a conversation with you about what they think. That's an indicator that you're doing good as a healthcare professional in interacting with the patient. And second, as you can see, patient may well have other options in mind that you have not considered. So why should not we take their opinions into account? Many patients are reluctant to express their views directly to the healthcare professional and need to be asked overtly meaning directly, if they are to overcome their hesitation. So directly asking is not intruding, but it just means that, what do you think? That's it. That's overtly asking. What are your thoughts about it? Do you agree with these suggestions? Or is there something else you would like to try? So we can always ask that. So if you show a clear interest in the patient's comments, in the future, the patient may be more confident about coming forward spontaneously with suggestions. So maybe you will notice that by the end of the task or by the last task, so the patient already feels very comfortable and they're ready to share their suggestions with you. And that is exactly what we want by making them feel comfortable. And the fourth point is that checking whether the patient has understood information. So one part of it, we did see that we are asking, is it clear? But this goes beyond that. So suppose if this is how we have effectively given information, I would also like to discuss some things you can do to increase or enhance the absorption of iron in the body. Firstly, you could combine the iron-rich foods with foods rich in vitamin C. Secondly, you can reduce your caffeine intake within an hour of eating iron. What are your thoughts about these suggestions? So again, the question is not just that it's clear. Use a variety. Don't just stick to, is it clear? Are you able to follow me? Is it clear? Are you able to follow me? No. So depending on the situation, use a variety of questions. So what are your thoughts about these suggestions? That's a good question to ask. And another way of checking if the patient is understanding what you're saying is the teach back method. Some of you might have heard of it, some of you might not have heard of it. Either way, it's fine. So teach back method would entail that you can ask the patient to repeat some of the information that you've given. So continuing with the same example that we were taking till now. So if you have already given all this information to the patient, like some examples of the foods are this, and then you can reduce your caffeine intake within an hour of eating iron. So if you've given all this information in chunks, so then you could ask a question to check their understanding. So you can say, I know this is a lot of information. It might not be very clear. So just to make sure that you've understood, would you mind repeating back to me what I told you about the foods you need to include in your diet? So it's not simply asking them, okay, so now I've told you this information, please repeat. No, that would be very rude. So this is what I said. So if you notice the first sentence, this is a rationale as to why I'm asking them to repeat. That is very important. So rationale as to why you're asking them to repeat, you should mention. This will prevent the patient from thinking that you don't trust the patient to remember the information. If suppose after the session, I directly ask all of you, okay, now tell me, what all did I say? It might seem like I'm a very strict teacher. But if I say that I just want to make sure that all of you remember it when you're giving your exam. So just to make that happen, could you please tell me what all did I discuss? Then you would feel much more open to tell me what all I have discussed. Similarly, for a patient, it would be great if you could give this rationale first before you ask them to repeat. So I know this is a lot of information. It might not be very clear. So just to make sure that you've understood, and then you come to the point, which is, would you mind repeating back to me what I told you about the foods you need to include in your diet? So then you can mention what you want the patient to repeat. Now, please make sure that you don't ask them to repeat medical information. So just the details that they would need to remember once they go home, or once they're discharged, or if it's a visit, so they are going back home, whatever instructions they need to remember, that is what you should be asking them to repeat. Sometimes I have noticed students, so if I'm explaining something about a medical conditions as a healthcare professional, so I shouldn't ask, can you repeat what I told you about diabetes? Or can you tell me how why insulin injection has been prescribed to you? So we are not testing their medical understanding. We are not asking them to clear any medical exam. But what they need to remember. So to take another example, suppose if you tell a patient that they need to follow this medication regime, they should apply this cream this many times, take this tablet this many times, you can ask them to repeat that because they need to remember that information. So please make sure you don't ask them to repeat any medical information. Only the things that are going to be useful for them. You can take a screenshot of this if you like, so that you remember how these can be framed. Okay, I'll go to the next one. Now, again, this is an activity for all of you. So this is what information the healthcare professional has given. So please read this. As a healthcare professional, you have given this information. can you probably frame a way in which you would use the teach back method? So how would you frame that question if you want to check the understanding of the patient? So you can type in your questions already. Make sure there is a proper rationale, and then you ask the patient to repeat. Try it. So some of you had written before that, would you mind telling back to me? So instead of telling back, I would say, would you mind telling me, not back to me? Would you mind telling me, or would you mind repeating? Repeating would be a better word than telling. Okay. Kulade says, I want to confirm you got my explanation. Can you tell me how to use the ointment and any precaution to take? Okay, yes, but you're already giving some of the answers away. So you could say that, okay, I'll give my sample responses later. I want to read what other students have said first. Can you please tell me what I've instructed you about sunscreen? Okay. Uh, Please, will you let me know? Okay, so that's another question. Could you please tell me what you have understood about what I have discussed regarding diet? So yeah, that was applicable for the previous one. Here is a different scenario, but I'm happy that you understood that. Renu says, could you please repeat what I've just told you to check whether you have understood correctly? Yeah, so Renu, make it more particular. So can you tell me about the instructions that I've given you? So something like that. Would you mind repeating what we have discussed? Yes, Nezi, but please add a rationale. Okay, so yeah, like Kupiwe has written, just to be sure we are together. Instead of together, there's a better word you can use, and I'll be giving you an example of that. Kindly tell me instructions about the sunscreen. So kindly repeat, because tell me would mean that the patient is telling you that for the first time, but that's not what's happening. Okay, so here is a sample statement that you can use. And again, you could probably, if you want, you can take a screenshot of this as well. So you can say, I know this is a lot to take in, so it might not be very clear. Would you mind repeating back to me the advice I have given you to make sure that we are on the same page? So this is an okay statement to ask. So I think you were saying we're together. So instead of that, you can say to make sure we are on the same page. Please make sure that you add a rationale so that the patient doesn't feel that they are under interrogation and that you're probably going to scold them if they don't repeat back the information. So please give a rationale and then you can ask them to repeat. Right. So this was the teach back method. Now, in the end, so we have reached point number 5, which is discovering what further information the patient needs by asking them directly. Now, you might have given them a lot of information already, and okay, you've done the teach back, everything is clear, they say it's clear, they've repeated back also. But they might have something else that they're concerned about as well. So we should always give them the opportunity to tell us that. So after you've given information from your end, and have ensured that the patient has understood, take one more step to ask from the patient if they have any more questions. Sometimes the information given to them could rouse some other questions, so it would be essential to directly ask them. So these are just 2 sample questions. Are there any questions you would like for me to answer? Are there any points that I haven't covered? Do you have any concerns at the moment? All of you can devise your own as well. So it's very important to ask them. So you might wonder that, I did ask in the beginning of the role play, do you have any concerns? At that point, they told me all the concerns. So what is the point in asking them again? Well, at that point of time, in the beginning of the role play, you hadn't given this much information to them. Now that they have information, so they would be thinking about a lot of things. And even though what you've said is clear, maybe another question pops up in their mind. So if we don't give them opportunities to ask that question, doesn't reflect that well on us. So always after you've given information, so after that lengthy bullet point, just take 1 second more and just ask them, is there anything else that you would like for me to address, or anything you would like for me to answer, or anything I haven't covered? Is there anything else you would like to ask? So there are all sorts of variations possible. So this is the last step that we should always cover. Okay, so this was all. These are the 5 points that you have to remember, and it will ensure that you get those 3 marks. So 3 out of 3 in information giving. So just to recap, the first point that we discussed was already establish what the patient knows already. So this is about assessing the patient's prior knowledge. It could be about conditions, about treatment options, or other information like causes, etc. The second thing that we discussed was pausing periodically when giving information and using the response of the patient to guide the next steps. So chunking and checking is what we discussed. So we should not give all the information all together. We have to break it down in chunks and then make sure that the patient is with us, that they're able to follow us. Third, we have to encourage the patient to contribute reactions and feelings. So not just that, is it clear or are you able to follow me? We can take a step beyond and ask that, what do you think about these suggestions? Or what do you think about it? Do you think you will be able to do that? Did you have something else in mind? So let's use those questions. And next, checking whether the patient has understood information. So for this, we use the teach back method. So we can ask them to repeat information, but please make sure that you're giving a proper rationale for it, and then ask the patient to repeat, and only repeating the things that they need to remember, not everything they should be repeating. Some of the students once, they said that, can you explain everything that we've discussed today? So no, you can't ask the patient to summarize the whole conversation. That's something you can opt for towards the end. But no, don't ask them to repeat everything. And lastly, we can ask directly anything that patients might be thinking about, or any doubts that they want clarified. So yes, this is what we have covered today. You could again take a screenshot of this slide if you like. I hope many of you told me that you have the exam tomorrow. So all the very best. I hope this proves to be helpful for you as some last minute tips that you can remember. So yes, that's it from my side. Thank you so much for joining, everyone. You've been very, very active. I can see that some of you have some questions about how much time you need to be ready for the exam. I think once you start, maybe join a course, or if you get yourself assessed by a trainer, that is when I think you will know more, because they would be able to give you personalized feedback. So yes, you can follow us on these platforms. Our numbers are here on the screen. On Instagram, we keep posting little reels of education. So if you like, you could follow us there as well. I would like to see all of you in the classes as well. So great. Thank you for being a great audience. And we would see you very soon. So Khaira Education would be back with more classes. Thank you, everyone.